Welcome to Cutting Edge Health. And today we're talking about a topic that we typically don't talk about, and that's our practice. For those of you who are joining us new, I'm Dr. Orlando Landrum, and today we're going to talk a little bit about what our practice is and really some of the things that we do that are unique. But before we do that, really what I want to do is to give those people that have made our clinic successful their shout out and props. First, we appreciate those who follow us on our both our Facebook page as well as our YouTube channel. Without you, we really wouldn't be able to carry this content for people that may be able to find this of value that aren't in our geographical region and really do need some knowledge about what options are out there. But in addition, our patients have been huge supporters of our clinic. And it's been huge for us because we're a little bit unique in terms of what a pain practice is. And we're going to go through some of the evolution of how the clinic started, what were some of the promptings for it, and how it is currently revising itself to be able to provide service to patients and clients who need it. First, before we get into that, though, I do want to say our patients have a number of different choices, and we're well aware of that. And you choose us despite some of the things that we could do better and some of the things that we have as a limitation, if you would, compared to other clinics. For us currently, one of the things that we're looking at is how can we really be able to lean into non-medicinal type therapies. But for many patients, we understand that medication helps you be functional. We do not minimize that. We do not limit that. And we certainly don't put that at your feet as saying that it's because you make choices that this is the wrong choice. Rather, what we want to be able to do is be able to deliver options that we know are unique in the space, not just here in Michigan, Indiana, and Illinois, but also that are unique in the pain space, period, because of our approach and how we go about looking at things. So accordingly, we really want to be able to help patients understand what are your options and how you can be able to leverage that so that you can feel better. I think there's a couple comments that are kind of coming in. Yep. So Elaine, we always appreciate you and the family joining us. Definitely one of our staunchest supporters, Miss Stangby, Mr. Valdez. We really appreciate you guys joining us and really being part of kind of our, not only our clinic family, but also our virtual family as well. So what we're going to do is talk a little bit about how the clinic developed, where it's going, and some of the unique services that we provide. Mostly those of you who join us on a weekly basis, you know that we highlight traditionally a service, an entity, some aspect of care that can be able to help improve people's lives. And it's not just the construct of pain, but many times it can be regenerative medicine, it can be behavioral health. And what we really want to be able to do is, so how can you optimize your best life and lead it the way that you want to be able to do it, and not because you've had other circumstances that have impacted it in a negative way, feel like you're stuck. So today we're going to kind of talk about where the clinic began and some of the foundations of it. So one of the first portions of a website was how do you relieve your pain and regain your capabilities? And it was a site that we originally put together through an outside source that didn't really understand everything that we do. And it was mainly focused on pain as just a whole. But before we kind of get into that construct, we need to talk about how pain kind of came about in terms of my understanding. And originally I was introduced to pain by a phenomenal doctor, Dr. Renata Veracruz from the University of Chicago, who's one of the best doctors you could possibly meet and or know. She was a doctor who knew how to be compassionate with her patients. She knew how to be able to leverage technical skill sets. And she was a doctor that was able to be able to inspire medical students, residents, and fellows to know that many pain patients have not been embraced, that they've been through the gamut of multiple providers who haven't been able to diagnose what their problems and issues have been, and have been made to feel like it's all in their head, which is a really disheartening thing when you can't be functional. You don't have an identifiable disease like you might have with a heart attack or a lung problem or other thing that you can really kind of put your finger on, but you know it prevents you from being able to do the things that you want to be able to do. And for me, as a young medical student, I watched this doc come in who was personable, who was able to be able to connect to patients, hear their story, not marginalize them and put them in a box, and then find a way to be able to improve what their problem and condition was. And it's one of the reasons why I went into pain. And in so doing, I was fortunate enough to be able to go to a number of different institutions that helped mold me and make me better as a person. And one of those places was Harvard. So I attended Mass General Hospital, and it is a hospital from a pain standpoint that is unique. Many pain practices as a whole traditionally develop and formulate in one construct, meaning that they have docs that are anesthesiologists or physiatrists or maybe sports medicine docs, but they really don't have a blend of that. And Mass General's program for pain and their anesthesia program, where they had residents be witness to what they did as fellows and attendings, was really shaping for me. And the reason why is because it was a multidisciplinary program. You had both attendings, fellows that were from different disciplines. There were anesthesiologists, there were neurologists, there were physiatrists, and they thought about things differently. It gave you the ability to be able to say what basic science had in place, what clinical components were, and then how clinical medicine for pain wasn't just focused on traditional medicine alone, but there was a traditional Chinese acupuncture clinic. There was psych that was present there. It was a broad ranging of how pain can be looked at, both scrutinizing down to kind of the molecule and medication to broadly and looking at how things that don't quote unquote fit in regular medicine actually have impact in a positive way for patients. So in taking from that, it really made me think over time, over years, to say, you know what, just because these things are tried and true, that doesn't mean that those are the only ways to be able to do things. And without having had that experience, it really would not have been something that would have been in my toolbox to kind of look at. One of the places that I trained was in New York at Columbia Cornell Hospital for Special Surgery and Memorial Sloan Kettering. And one of the things that they did is really had a differing, personalized way that physicians did things. How doc number one did it versus doc number two was widely variant in talking about the same topic, which is really kind of interesting, unique. And one of the things that they leaned into is different types of therapies, particularly ketamine, at Hospital for Special Surgery for crush injuries and for patients that had really severe disease, that you'd have limbs that were mangled in purple and different colorations, that post ketamine infusions, which we were pretty aggressive at the time to be able to take that from those colorations to normal or near normal and back to functioning in a different fashion. And having done that as a fellow and had those patients kind of under my care were significant in molding to say, you know what, maybe there's a role for this, even though it's not mainstream in a lot of different ways at the time. Having left both of those institutions to then get into traditional pain practice in Florida and Illinois and Indiana, things were standard. So we did things like medial branch blocks and facet joints. So traditional arthritis type diagnoses that we would treat by going after the nerves of the joints, right? Or dealing with disc pathology by dealing with things like bulging disc or herniated disc or degenerative disc disease, and seeing how could we possibly be able to impact that in a way. Thank you, Mrs. Singer, for giving us this thoughtful congratulations. And we know that during this time, it's really considerate of you to take time from your schedule and the things that you're doing in order to be able to give us this congrats. Thank you so much. Many of those things were traditional pain, right? And the market kind of drives that at times when you look at hospital systems or when you look at how groups of physicians say, you know what, this is what we need to do. And this is the way that, this is the way that we can be able to run a practice and run it successfully. And all the sort of bright ideas and thoughtfulness that I'd seen in some of the academic institutions were really kind of channeled in terms of simple therapies in a lot of ways. And it wasn't really that broad. And quite frankly, I had a number of colleagues that reached out to me and said, hey, you know what? There's a different type of treatment that's out there that I think you need to know a little bit more about. And one of the things that they were talking about was something that's called neurofeedback. And neurofeedback has a number of different utilizations, but at the end of the day, it's a way to be able to take a look at brain waves and how can you be able to improve conditions traditionally that are in more the behavioral health, but can be utilized in things that deal with some of the physical health ailments as well. And ironically, it was by happenstance or serendipity where I had two separate docs, both of which who were anesthesiologists that were cardiac anesthesiologists whose spouses ran two differing biofeedback, neurofeedback clinics. And I had the chance to kind of go and witness what it is that they do and the impact that many of them had upon children. And as I was watching these things and how they impacted kids and their family, it made me say, you know what? I've kind of narrowed my focus. I've been in this area of just saying, let's just do the regular tried and true. And it made me rethink, well, perhaps there's some things that I should be doing differently and I should lean into. And so what I decided to do was to broker a clinic that was the following, that looked at neurofeedback specifically for pain and performance. And that clinic was started in Chicago, but it never really got the legs that I wanted it to have. And it was something that sort of kind of kept close to my heart and my spirit and said, you know what, if I have a way to be able to do it and impact people in a different way, I really want to be able to utilize something like this that looks at the whole of the person and really says, how does this not just prevent you from being able to have a problem with your arm or your elbow or your chest or your leg or whatever else, but how is that impacting how you feel about not being able to help the people you care about or be able to do the things that you want to be able to do, and to look broader at that. And coming to the Elmas of North Central Indiana, in and around South Bend, Elkhart, in those regions, one of the things that took place at the clinic that I joined was we had patients that had a number of different problems that presented themselves post-surgery, where they had knee pain after having a knee replacement. That's not common. I'm not knocking orthopedic doctors. I'm just saying that it can occur. And so for some of those patients, I was really prompted to have a debate. And it was a pretty prominent debate at the time with a number of docs that stated, you know what, we really need to just treat these patients in the traditional way. In the traditional way at the time, because they've had surgery. So that means that steroids aren't going to work. Physical supplementation isn't going to work. It meant using opioid therapy as a treatment option. And it wasn't that I had some great epiphany to say, you know what, using opioids is so wrong or it's an inappropriate fashion, but really was more like, it can't be the only option. There's got to be other options. And we debated this and went back and forth. And one of the things that came forth from that clinic was the utilization of something that's called COOLIEF. And COOLIEF at the time was not present at all in South Bend and Michiana. And it was one of the first docs to bring it here, so much so that we got a national evaluation of different places from North Carolina and Colorado and patients that were interested in coming to our clinic to be able to have this treatment. And COOLIEF is a treatment of the nerves that allows for relief for peripheral treatments similar to what we do in the spine by trying to stop that nerve from having a problem or issue. There are other therapies that were similar in nature, things like dorsal root ganglion stimulation, where instead of traditional spinal cord stim, you put a lead out onto kind of the brain of the individual nerve, which lets you be able to get a different type of success. It gave us success that was 80% versus sometimes of a 50 to 70% that we might see with traditional. And that treatment was a little bit involved. It involved us having to do some things that were unique and different. But at the end of the day, it helped be an offering and an option for patients that otherwise wouldn't have gotten that offering. And so what ended up happening is there was a number of things that kind of got brought to my attention while I was part of this clinic that made me rethink some of the things that we do. And some of those things are things like steroids and how they can cause some challenges. And we knew this, but it really started coming out more and more, particularly as there was an issue with steroids having this infectious piece that really kind of ripped through Michiana at the time. And we started reevaluating that it can have fluid disturbances. It can have demineralization disturbances. It can have issues with the GI system and endocrine and nervous system that isn't always talked about. And just because it's standard doesn't mean that it's right. So what started to kind of come about was, how could we do some things differently? And again, the fact of the matter is my path wasn't a path that I was like, oh yeah, I know I'm going to do this and I know I'm going to do that. It was more things that came about. And I had a patient come to me in clinic one day and he said to me, you know what? You're a good doctor, but you could be better. And the way you could be better is by starting to look into some regenerative medicine techniques like this one entity is doing out in Colorado. And when you have someone say that to you, it can take you one of two ways. One, you could say, you know what? This guy doesn't know what the heck he's talking about. I don't need to do anything different. I'm good, right? Or you could say, you know what? Well, maybe he's got a point. Let me kind of take a look. Fortunately for me, at the time, I was open enough to take that latter path and go see what this other entity was. And that entity was Regenexx. And one of the things that they were doing was really looking at interventional orthopedics. So what the heck is interventional orthopedics? It's a way to be able to try and treat musculoskeletal conditions without using traditional surgery. And that field is progressing, not just through Regenexx's efforts, but through a whole host of different things where you're talking about things like the American Association of Orthopedic Medicine that really looks at interventional and percutaneous ways to be able to improve problems that historically have been treated by surgery. There's thoughts about whether 70% of orthopedic traditional surgeries may be converted to percutaneous type approaches, meaning a needle-based treatment option. And many people would scoff at that. But if you take a look 20 years ago, 30 years ago, the same thing took place with cardiac surgery and cardiology. And many things that can be done now through a percutaneous approach from a cardiology standpoint wasn't thought to be able to be doable when it was presumed that cardiac surgery was the only mechanism of treatment. Be that as it may, what ended up taking place is I started seeing some exposure and started seeing how regenerative medicine really could be able to be of value. And I brought this back to the clinic that I was part of at the time. And I had docs that just really weren't able to kind of see that as a solution. And we talked and we went back and forth. But at the end of the day, it wasn't really kind of clicking. And so I was fortunate enough to be able to have another thing happen by happenstance, where I got a flyer one day that introduced me to Kelley School of Business that was focused on physicians. And that school was transformative, where it didn't just take the utilization of business, but how do you combine it in a way that allows you to be able to serve with passion that of patients and have both the understanding of how healthcare works and how to be able to leverage that with how healthcare is put into the construct of both public health as well as medicine. So much so that I had people that were kind of my champions that helped me understand how I could put together an integrative clinic and really be able to look at things like social determinants, things that influence how we have health that causes different problems like behavioral health and genetic health and social circumstances, and those things that impact pain, which normally are looked at from a cardiology standpoint or diabetes standpoint or pulmonary standpoint. There's not just genetic, but there are ways for us to be able to figure out how can we impact patients in a differing fashion and do it with a different approach. So things like complementary medicine, which have been excluded in a lot of ways, where we talk about things like traditional Chinese medicine or acupuncture or chiropractic or different movement type treatments that are out there, or herbal therapies or vitamins, have a place and have a role. And finally, after talking to people in that business school and seeing other students that were really doing it already, I said, you know what? Well, I'm gonna go for it. Let's put together a clinic. And that happened 5 years or so ago. And that clinic was our initial formation, and stages were the following, where we started off in a small clinic on a second floor without an elevator that was like, okay, we're going to start doing all these different types of therapies, and we're going to try to figure out how can we be able to offer value to patients. And I will tell you, most of the patients that we treated, they had no idea all the things that we did and what we do. And so some of those things include everything from minimally invasive endoscopic spine to spinal cord stem, of all the different variances, which is a little unusual to be able to do traditional high frequency and dorsal ganglion, to regenerative medicine techniques that span the gamut from C0, C1, which basically means the area of where the skull connects to the first cervical vertebral body, all the way down to the foot and plantar fasciitis, so spine, shoulder, knee, which is a little unusual. Neurofeedback, and then transcranial treatment options, ultrasound guidance with the most exacting methods of being able to utilize that, to percutaneous neuromodulation, to controlled cooled radial frequency ablation, to kyphoplasty and various different percutaneous and intradiscal and elements of the spine that deal with stenosis that allow for us to really be able to impact patients in a different way. And again, this is not meant to be a boastful element of accolades, but more so, what do we do as a clinic that's unique? And one of the things that we really leaned into was to talk to the community about how can we leverage resources that we don't have underneath our roof. And what we want to be able to do is to have ways for patients to understand we're not just flying by the seat of our pants, but we're really evaluating this by saying, how can we be able to determine how this impacts pain by being able to measure it? Because if you can't measure it, it's sometimes very difficult to be able to improve it. And so what we started looking at was, can we be able to look at, are there functional measures for things that impact the ability of how you can't do the things that you want to be able to do? Are there ways to be able to look at mood and your emotions and say, how can we look at depression and anxiety and PTSD? How can we be able to look at sleep and how that is measured, and what are some of the challenges that are associated with it? And how can we be able to look at risk, particularly when we're talking about using medications, and hopefully be able to decrease that risk as a problem? So with that, is as we started looking at how we can impact patients and really say being influential, we wanted to really branch out. And one of the things that we initially did was to go into multiple different spots. We had a place in Elkhart, we had a place in Mishawaka close to South Bend, we had a place that was present in Bremen, and we really went across wide variances of the areas to say, how can we really do some things that were different? And that took us into doing things for populations that really needed it, particularly some of our elderly patient populations that had issues with stenosis, where there's difficulty with being able to stand and walk for a period of time. And you had this classic shopping cart sign where the patient leans forward and it relieved their symptoms, or they were to sit and they got better, right? So what we started to say was, how can we be able to treat that? And so how we were able to treat that were things like Vertiflex, where you're able to put an interspinous spacer that's in place and really be able to provide relief, where you can be able to have a different option that allowed for you to have a spinous treatment option that allowed for you to be able to have this spacer that was put in a percutaneous fashion. And that percutaneous fashion didn't require you to have to be overnight. It didn't require for you to have drilling into the bone, or you having to have this major intervention. And in so doing, it allowed for us to start looking at treatment options that were similar to that gave value, but were different. And so those are things that were like spinal simplicity, which is of a differing ilk that we've talked about on talks, where instead of us talking about it opening from a certain vantage point, it opens from the side. And you can see these options that allowed for advantages for patients that didn't have to have traditional fusions, but had other options that were in place. For us then being able to explain to patients about arthritis that's present in the knee, what that arthritic component meant, how there were grades from 1 to 4, and how that can then be potentially influential to what's going on with the meniscus and the cushion in between, and how we can be able to influence all of that with regenerative medicine by using different types of techniques to help that in a different way than what traditional medicine thought about. And as we started doing more of that, it really started to develop, so much so that basically about 2.5 years or so ago, we ended up moving to a different office, and that moving to different offices is our current location. And accordingly, we were able to start leaning into doing more regenerative medicine, where we're doing PRP, we're doing stem cells that brought value to patients. And so what ended up taking place is we started looking at how can we be able to get the message out, at least at that time, for some of the things that we did that were unique, that differentiated us in the market compared to other pain clinics that said, let's just do radio frequency and epidurals and use steroids and call it a day, and maybe do an implantable device here or there if we thought that it was warranted. So one of the things that was our premier utilization was the aspect of regenerative medicine, and still continues to be. And the main reason why is because we're not looking to just treat pain. What we're looking to be able to do is to have that person be functional. So going all the way back to medical school and having that doc that was able to bring in and hear the story and say, what's the patient's why? And most patients, yes, they want to feel better. There's no doubt about that. But many times it's not just a feeling better. It's because I want to be able to do what I want to be able to do. And many times regenerative medicine makes that not just a one-off and then you come back, but this sustainable treatment that allows for you to be able to get back on your feet and really take life by the neck and say, you know what, I'm back and I'm able to do the things I want to be able to do. On the other pillar was us looking at neuromodulation, both non-invasive and invasive, because we really do believe that the brain and body, when melded together, are huge ways to be able to advance how you can be able to improve health. And in that same vein, that mood and social construct of having depression, anxiety, many times are just marginalized when we talk about how these ailments can affect us. And without going into depth and detail, for me personally, I felt it. And that molded my practice. For me to have an experience of having my own areas of pain and my own complaints of depression, to say, you know what? If I feel like this, then certainly my patients feel like this. And it's not something that I want to have ignored. So we're not going to ignore that in our patients. For us then to finally say, you know what? How can we be able to look at this from an integrative standpoint and talk about not just complementary therapies as an associated piece, but really bring it into the fold? And that's really where we're going as a practice, to not just look at it as, hey, you have a cut, you have an injury, you have a sprain, you have a twist, you have a herniated disc, but how can we be preventative? How can we see, is this more likely for you to have this problem and issue? And if those things, we can't prevent it or we can't treat it with the first few things, then for us to lean into, let's deal with it in a minimally invasive way. And that's us being able to use different treatment options along a gamut and spectrum of treatment to say, okay, how can we do this minimally invasive and proceed to the point that hopefully we're not having to go to surgery, but we can really be able to give you a true treatment. And it's one of the things that's unique about our practice, where we're able to do things like look through a scope and go after a disc that has a herniated disc and be able to resect that by sparing the muscle. And knowing when is the appropriate time to do regenerative medicine, when is the appropriate time to do a technique such as this, and is there a mixture thereof that can give you the best outcome? And fortunately, as a clinic, I think we've been able to see how other practices do it and do it in a gold standard and try to be able to mimic that. Things and treatments that have come across us from a scientific standpoint that has helped us be able to have better communication with our patients are things like NeuroFlow, that we're able to say, hey, we're able to see what's going on with that patient. They give us information about how they feel, and then we can take that information and then hopefully be able to impact their lives in a different way. To us then be able to use things like biomarker testing, where we're able to assess what are some of the deficiencies that are present in the diet, how can we be able to modify that? And that's something that we're really leaning into to be able to help patients as we move forward. Because we know that patients have more autonomy than what we sometimes give them in the medical profession. And we want to be able to help you be able to make choices for what makes sense from a supplemental standpoint, what makes sense from using some medicines versus not. And those things that can impact your pain, instead of us masking it with the traditional treatment, how can we be able to diminish it even before we get to the point of traditional treatment utilization? And then really from a behavioral health and how it affects mood, we are one of the few clinics that do things like ketamine, that are able to do traditional IV treatments and be able to say, how can we look at what's depressed, what's not depressed, how we assess that. And then we're one of the few clinics in probably not just Michiana, but maybe the Midwest, if not parts of the states that's a pain clinic that does behavioral health, that has the utilization of ketamine, has the utilization of something like Spravato, and can be able to do TMS, which is transcranial magnetic stim. So when you look at our clinic and we're able to say, come into our office and see, this is what we have to be able to offer, how we have a regenerative medicine lab that allows for us to be able to isolate, how we have leaned into complementary therapies like external laser utilization to be able to improve wound healing, or behavioral health modification by using things like a TMS chair. Those are the things that really make us unique and make us different. But at the end of the day, the things that I think really kind of encapsulate not just the science, but how we relate to patients, our staff, and our ability to be able to really put together the humanness of saying, who are you? What's your why? And how can we be able to get you to be able to do the things that are important for you and for the people that you care about, and get you back to leading the life that you deserve and doing it better than what you even did it before. I appreciate those of you who have supported me and my clinic for the last 5 years, and we hope to be able to endeavor to give you the best service we possibly can for the next 5 going forward in the future. Thank you so much.